All right, let's jump right in. Welcome to this explainer. Today, we're going to demystify exactly how you can step up and take control during a sudden cardiac emergency. You know, our hearts are just truly amazing organs. They work incredibly hard for us every single second of the day, tirelessly pumping blood and oxygen to every cell in our bodies. And we kind of take it completely for granted, right? But what happens when that automatic, life-sustaining system just shuts down? Well, today we're looking at the sheer mechanics of CPR. We're going to strip away all the panic and look strictly at the physics and biology of how you, using absolutely nothing but your own two hands, can literally become an artificial pump to save a life.
To understand the solution, we've got to understand the crisis first. Section 1. When cardiac arrest strikes. This is a profoundly sudden, unexpected event. We're not talking about a gradual slowing down here. So, what exactly happens inside the body in that very first second when the heart suddenly halts? Well, the answer is stark. Blood flow just stops. The delivery of oxygen to your vital organs instantly zeroes out. The whole system is completely paused. And without any intervention, the brain, the vital organs, and the heart itself immediately begin the process of dying.
Now, what's truly terrifying about this biological countdown is just the sheer speed of it. At minute 0, like we said, blood flow stops. But think about that 4-minute mark. 4 minutes. That is how insanely fast brain damage begins to set in just from a lack of oxygen. I mean, in the time it takes you to brew a cup of coffee, the brain is already taking casualties. And at the 10-minute mark, that brain damage becomes completely irreversible. This chilling timeline perfectly illustrates exactly why bystander intervention is a person's only true chance of survival. You literally cannot afford to wait for paramedics to arrive to start the clock. You have to freeze that countdown yourself.
Which brings us right to Section 2. Creating an artificial pump.
So this is where you step in. And you're not just doing a medical procedure, you are manually taking over the physical labor of a failing human organ. Your very first primary objective, move oxygenated blood up into the brain to keep it alive. That is priority number 1, protect the brain at all costs. Step 2 is equally fascinating from a mechanical standpoint. Your compressions actually keep blood and oxygen moving into the heart muscle itself. Why? Because you're priming it. By keeping that heart tissue oxygenated, you're giving it the absolute best chance of resuming a normal electrical rhythm later on when paramedics do arrive and deliver a shock with a defibrillator.
You are, quite literally, creating an artificial pump, just like a mechanical water pump. You're doing the manual work by building up pressure in the circulatory system. And you know, it takes time to get that fluid moving. With every single good, effective compression you make, you're slowly building up the systemic pressure that's required to physically force blood around the heart and up against gravity into the brain. It definitely doesn't happen on the first push. It's a compounding buildup of physical pressure.
Which leads us directly into Section 3. Push hard, push fast.
To build and maintain that artificial pressure, you absolutely must hit 2 vital metrics. First up, 2 inches. This number is non-negotiable. When you push down on a patient's chest, you have to push down at least 2 inches. Mechanically speaking, this depth is the only way the heart gets physically squeezed between the breastbone and the spine enough to actually force the blood out of its chambers. If you don't hit that 2-inch mark, you just aren't squeezing the pump tightly enough to move the fluid.
And right alongside depth, we've got speed. 100 to 120. That's the number of compressions per minute you need to maintain. Just think about how fast that actually is. It's almost 2 beats every single second. Pushing at this rapid, continuous rate is strictly necessary to keep that blood pumping constantly.
It really takes a massive amount of physical energy to keep the pressure up in that system.
But what happens when we falter? Let's move to Section 4, mistakes that stop flow.
So, what causes our artificial pump to fail? Well, the first major mistake is taking your hands off the chest. When you pause compressions, maybe you're delivering breaths, or maybe you're switching roles because you're just exhausted, what happens? The blood stops moving to the brain instantly. All that pressure you just spent immense physical energy building up, it drops to zero the exact second you stop. So it is absolutely critical to minimize your time off the chest to preserve that built-up systemic pressure.
Next, let's look at the physical input versus the biological output. If you're pushing too shallow, meaning less than those 2 inches, or you're pushing too slow, meaning less than 100 beats per minute, the outcome is exactly the same. Blood does not reach the brain. Failing to meet the depth or speed requirements simply means your artificial pump isn't generating enough mechanical force to push the fluid where it desperately needs to go.
Now, here's a really counterintuitive point. You might be thinking, well, if fast is good, then super fast must be better. Actually, that's not true. If you push too fast, like exceeding that 120 compressions per minute mark, you encounter a totally new mechanical failure. The heart literally doesn't have time to refill with blood between your rapid pushes. And if the pump is empty, it doesn't matter how hard you squeeze, not enough blood gets pumped out.
And the exact same physics apply to our next mistake, not allowing the chest to fully recoil. When you push down, you must take all your weight off the chest on the way up to let the body fully decompress. If you lean on the chest and prevent that recoil, the heart is kept partially squeezed. It cannot refill with blood, and therefore no blood gets pumped out on your next compression. The pump absolutely must be allowed to open back up to draw the next round of fluid in.
Let's bring all these mechanics together in our final section. Section 5, the power to save lives.
Okay, so you now understand the plumbing, the physics, and the pressure. Now it's all about empowering you to do whatever it takes to keep the brain alive. Your core mechanical directive is this: push hard and push fast in the center of the chest. Maintain that pressure. Keep that oxygenated blood moving within the heart and straight up to the brain.
This next point addresses the single biggest fear that paralyzes bystanders during a crisis. Listen closely. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. Pushing 2 inches deep into a human chest requires serious force. And yes, sometimes bones break. We really have to normalize this physical reality. A broken rib can heal, but as we've learned, after 10 minutes, brain death is totally irreversible.
We've seen the mechanics, the timeline, and the incredible power you hold in your own 2 hands to sustain a life. When a heart unexpectedly stops and that 4-minute countdown begins, you become their artificial pump. You are their only hope. So when the moment comes, will you step up? Use what you've learned in this explainer today and never give up until medical help arrives.